A closer look at a startling new study we first told you about earlier this week. Most pediatricians say they're not prepared to treat teenagers struggling with opioid use.
Dr. Scott Hadlin's back with us tonight. He is an addiction specialist at Mass General for Children. Dr. Hadlin, good to see you.
Good to see you too.
All right, you led the research for this study. Let's look at the numbers that you found. 48% of pediatricians did not feel equipped to counsel teens on opioid use. Almost half, 24%, a quarter, said they diagnosed opioid use disorder in a young patient, but just 5% had prescribed medication for it, the standard of care. We turn to our pediatricians for everything, ostensibly until a kid turns 18, right? So what's the message for parents here? Because we both have middle schoolers. We know it does get more complicated as they get older.
Right. And just to put the study into context, overdose deaths are at the highest rate in teenagers that they've ever been. Overdose deaths now kill the equivalent of a high school classroom of teenagers every week across this country right now. So this is a serious public health issue. And what our study found is that despite the severity of this issue, most pediatricians who, again, pediatricians are who families turn to when their teen is struggling, most pediatricians don't feel ready or equipped to take on this work. And so what I want parents to know is that even though pediatricians have big hearts and we want to do what's right for our patients, it's entirely possible that if you go to your pediatrician, which I recommend you do if your teen is struggling, they might be as new to this issue of opioid addiction as you are.
Okay, so you were talking about just this incredible risk. So how do we fix it? I mean, obviously parents advocating for their kids, but how do we help doctors?
Right. So, I'm trying to be a part of this. And again, pediatricians have big hearts. They want to do what's right for their patients, but we need more training. And so we need training on how to handle addiction when we are in medical school. We need it in pediatric residency. We need it when we're doctors out in practice. We need sort of continuing medical education so that we can keep our skills up. And I guess the other thing I would add is that we need to make sure the incentives align with the work. Right now, when a pediatrician sees a child with a sore throat or a runny nose or an ear infection, that's a quick visit. And the healthcare system is set up in such a way that, it's financially advantageous for pediatricians to do lots of those visits. But the incentives are not set up for a pediatrician to take the time that's needed to work with a teen and their family. And so we really need to push policymakers and health insurers to make sure that this work is compensated.
So I want to ask you a question about that, actually. A lot of these pediatric practices, I know the one that I go to, have multiple doctors, maybe as many as a dozen or more. Do you think that maybe at a certain age, I don't know if it's 12, 13, 14, should there be pediatricians who focus more on the teenage or adolescent years versus the young years? Should we kind of diverge the specialty here a little bit?
Yeah, I mean, that's actually what I do in my practice. I'm sort of one of the doctors, and we have a whole team of doctors at Mass General that take care of teenagers and specialize in working with this age group. And so, certainly it's not the case that every pediatrician in a practice needs to be able to treat addiction, but, one or two should be able to, so that you've got someone to turn to.
And as a parent who's concerned, what questions should parents be asking at this point?
Yeah, I mean, I think it's very appropriate for a parent to just ask their doctor, have you seen this before? And have you managed opioid addiction before? Some pediatricians have, and they might be able to help. Others might not be able to, but I think that they're going to be forthcoming with parents. And again, because they care, they're going to want to do the right thing and get patients and families connected to services. I guess the other thing I would say to parents is that there is a state helpline here in Massachusetts. We're very fortunate to have a website, www.helplinema.org, that families can turn to get connected to substance use treatment if their teen needs it. And that's a tool for us as pediatricians, and families can turn to it as well.
Helplinema.org. Good info, good study, good information. Thank you, Dr. Hadlin. Good to see you.
Good to see you too.
Thank you, Dr.